Welcome to the Wellness Project series brought to you by Health Promotion 8-Wing CFB Trenton, and today's topic is entitled Reducing Your Risk of Injury. So, question for you, what's your favorite physical activity? What is it that you enjoy to do when it's time for your workout, or time to be outside, or time to just have some exercise? Another question, fill in the blanks here. Have you maintained, increased, or decreased your activity level over the past month? And is that something that you're working on? Is the frequency of your workouts? And another question, over the past year, have you injured yourself seriously enough to limit your normal activities? So has something happened that you've had to miss that workout, or not been able to go to a class, or maybe had to take a week or two off because of a sore calf muscle? So just consider that. Has injury affected your normal activities? We're going to start to talk about some statistics in this portfolio, and we take some of the stats are taken from the Healthy Lifestyle Information Survey. So you'll notice the slide reports about 42% had reported an injury serious enough to limit their normal activities in the previous 12 months. So this community often partakes in that HLIS, and these are the results of that. The second bullet talks about 44% have reported musculoskeletal injury as the reason they were unable to deploy in the previous 2 years. So this slide is suggesting that there is some trend there, statistics that would suggest that exercise is being limited as a result of injury, and so is deployment. In this presentation, we're going to categorize our injuries into two brackets. The first one is RSIs, or repetitive strain injuries, and the second one is acute injury. So those RSIs are categorized as that cumulative trauma where tissues are damaged by overuse or repetitive movements. So imagine for a second you're a runner and you are running about 4 or 5 times a week. That running potentially is using the same repetitive movements, the same muscle recruitment, same body parts over a period of time that could in fact result in some cumulative trauma. 32% of the calves sustained an RSI in a previous year, and it is higher than the most previous time to this of that HLIS data reported, and it's higher than 22%, so significantly higher. So went from 22 up to 32% in that next reporting period. We also saw through those statistics of the data reported that the incidence of injury went up with age and with body mass index. Another important note is the rate is more than twice higher than the Canadian population. And 37.6% occurred during the sports and physical training, and only 2.4% were battle related. So those are important stats to ponder as we move through this presentation. Acute injuries, on the other hand, those are linked to a single traumatic event versus that accumulated injury potential. So that repetitive strain injury accumulated over a period of time, an acute injury associated to a single traumatic event. So that would be, as an example, you're playing hockey in the noon hour hockey league at your base, and you get knocked into the boards, you take a nasty fall, and you dislocate your shoulder. That would be considered an acute injury. And almost 20% of the calf population experienced an acute injury in the previous year. We didn't see much significant change from the 20% in 2008 to 9, the previous reporting period. And in the case of acute injuries, these do not vary with age, BMI, element, rank, gender, or activity level. But we do note that the rate is still higher than the Canadian population, and almost 50% of the acute injuries occur during sports and physical training. And really important to note that 3/4 of them occurred during supervised activities. And again, the battle-related injuries were very low, around 2% less than. So this slide just categorizes the body regions that were injured. So when we take a look at acute versus RSIs, and we take a look at the categories of body regions, We see at the top of the list for both acute and RSIs are lower extremities. Next, for the upper extremities, we see about 30% and 18 respectively, 15 and 20 for vertebral column, 10 and 0 for head neck, and then 10 and 5 for the other body regions that were injured. So the specific types of injuries most often reported, and it's always great to take inventory just to understand what is the trend. We're seeing a lot of strains and sprains, back injuries, and certainly body regions are hip, knee, ankle, foot, shoulder, elbow, wrist, and hand. And for RSIs, low back, knee and thigh, and shoulder and upper back. So important to notice just what those trends are, especially if in fact you're trying to prevent or you're trying to recover from and trying to deduce what may have contributed to your injury. So where do you think most injuries occur? We know right off the bat that the battle-related is only accounting for 2% on both acute and RSIs. So you would be correct if you put the energy into sports PT, the military exercise, physical training. If you've ever attended a base general safety meeting, you will notice that a lot of the injuries or lost days of work that we do see in our CAF community are attributed through those particular areas. And as a previous slide mentioned, often supervised. So it's an opportunity for us to sit up and take note. So sports activities that are causing the injuries, most common activity leading to a serious injury in the calf is running and jogging. So should not be a surprise from an RSI perspective, repetitive strain injury, cumulative over time, and causing trauma that presents an injury. Some other activities for a large number of serious injuries, weight training, ice hockey, and rucksack marching. Some injuries and activities, so as the slide suggests, right at the top, sports and physical training, right at the bottom, battle-related injuries and activities, and then you'll see in the middle with the percentages being dispersed through both categories, you'll see the military training, the physical testing, the leisure, the office work, as the slide suggests. So what is the issue here with injury potential? The rates are high. Especially high in the calf, and as previous slides noted, much higher than the Canadian population. It can also cause some personnel stress, and CAF leadership absolutely wants to provide better injury prevention support to our personnel. We also know that there's some scientific evidence that can provide some clear direction for prevention and physical training in sports, and we need to apply it within the CAF. The stats are in, the trends are there. We have this picture, this snapshot of what's causing our injuries, whether it's acute or RSIs, and what body regions are affected mostly and what activities are contributing to that. So there's an opportunity to use this information, to use the scientific evidence to make some positive change. So what percentage of injuries are preventable? Hopefully you're looking at B as that category, 80 to 95%. So that's a huge number when we're looking at prevention. And in health promotion, that is our mandate. We're providing health and wellness from the end of the spectrum that is all about prevention. So there's an opportunity here to take a look at the information presented to us and make some positive change to prevent a potential for injury, which could impact not only your work life, but your personal life. So there's an opportunity also to look at injury predictors. So previous injuries, asymmetries, so a difference versus left, right, pain during exercise, and we want to put some attention on dysfunctional movement patterns. So if you are experiencing an injury, there is that question when to consult. So you're going to definitely want to monitor those persistent symptoms, and you're going to want to reduce your training intensity until there are no symptoms. However, being injured does not mean that you stop training. You are able to modify training. So say, for example, it's an impact injury. Well, then you could take to doing something that limits the impact. So for example, you're a triathlete, you've injured yourself running, you certainly can still maintain your swimming portion of your training, but you would absolutely have to modify until the symptoms were gone for the injury affecting your running. You want to keep small injuries from becoming bigger, and you want to get assessed early. You definitely want to consult with a healthcare provider, get that early intervention, and absolutely, as your symptoms persist or worsen, there is the opportunity to absolutely see with a practitioner for positive results. So this slide just talks about the two definitions of mobility and stability. And when we're looking joint by joint at that particular concept, it's really important to recognize that mobility is about the ability to create movement around a joint, where stability is the ability to resist an undesired movement around the joint. That's why we see so many athletes, and maybe high performance athletes, that do a lot of their training with unstable surfaces. So in fact, they're trying to absolutely improve their stability to resist that undesired movement around the joint by challenging their stability muscles. And then, as the slide suggests, we have some base physiostatistics that had the highest referral rates, and typically they see knees and lumbar spine as being the body parts that have very high referral rates at base physio centers. So this next slide just talks about pain as often a symptom of the joint above or below not functioning properly. And you'll see on the left where you have thoracic mobility, then you have lumbar stability. Where you have hips mobility, you have knee stability, ankle mobility, etc. So where the next slide shows where the pain might present itself above or below the joint that's not functioning properly. So when we take a look at all of those elements of our fitness, it will be really important when we are looking at the topic of mobility versus stability that, yes, alignment, that is a great foundation. Mobility and stability in the black box there, functional patterning, strength, and power. So really important to recognize the relevance of those two, stability and mobility, as it pertains to injury. Some movement effects. So this slide shows you some poor movement patterns and then alternatively suggests some proper movement patterns. So squat variations you'll see in the first segment, hinge variations, so deadlift variations, row variations, and bench press variations. So obviously the top picture is poor and the lower picture is desired. Absolutely, the limitations in your mobility or stability could affect your alignment and thus affect your exercise safety and you executing it safely. So it's important to note that the low back and core, we have some major no-nos. There's recommendations to avoid repetitive trunk flexing. So whenever possible, look for alternative exercises to strengthen the core. And you'll notice that the slide suggests sit-ups are not a good choice. For many of us, we probably remember the 20-meter shuttle run PT test. And an element of that were the sit-ups. So recognizing that that's not a good choice because that includes repetitive trunk flexion exercises. So you're going to want to look core exercises that will avoid back injuries and look for alternatives to working that muscle, but in a way that is not going to increase your injury potential. So instead of focusing your energy on stretches that bend the spine, turn instead to stabilizing and controlling the spine. So it's a very popular kinesiologist, professor here in Ontario, Stuart McGill, and again, another visual for some options. Options to be encouraged and what they in fact are applied to or can be associated with when we look at some of the common tasks that we're seeing our CAF community be encouraged to work towards. So anti-extension would be the prone plank, and you'll see below the PSP employee doing a farmer carry. You'll see the bridge, a double front kettlebell carry. You're doing the side plank there on the top picture and a suitcase carry. And when we're looking at the stabilizing and controlling the spine, these particular visuals are really important. So some things that don't prevent injury. Static stretching is known to just be holding that stretch for 15 seconds. That static stretching should never be done before a workout, so certainly that's not going to prevent an injury. We know that from our scientific evidence, orthotics do not prevent injury. Running shoes, even if they're tailored, they might not prevent an injury, because if you're still going to wear that very tailored running shoe and you're going to repetitively perform the same task 5 to 7 times a week, it won't matter the shoe. You will still be setting yourself up for potential RSI. And that we also know the lumbar support, the flexible or rigid braces do not provide an injury prevention. So this next slide talks about running, and we know that it's right up there as one of the activities that contribute to the highest percentage of injuries. So more than 80% of injuries can be explained by overload, too much or too soon. We also know that orthotic shoe inserts do not correct faulty running mechanics. And when you're speaking of prevention of running injuries, there's enough proof to clearly establish the clinical guide. So we want to take a look at Running 101. Some very general practices that we encourage people to follow. We want to progress running slowly in terms of the duration, frequency, and intensity. We want to decrease the duration if other weight-bearing activities are on the same day. So if you have a rucksack march on a Monday, but that was one of your run days, that would be an opportunity to decrease the duration if you're already doing a weight-bearing activity the same day. If you're changing your running technique, do it progressively. So don't make a sudden change quickly. Progress. The principle of progression will be very important. Some more running strategies. You want to make sure you're warmed up with dynamic movements, no static stretching. You want to be doing your runs with similar abilities. That can decrease the injury potential by 30%. You want to limit those unit runs, 30-minute max, and potentially even once a month. Those unit runs will not always be the individual's interest, in that it'll be a multifaceted fitness level, and you're doing these unit runs that might not be conducive to making sure you're able to follow the principle of progression. We don't want to see any endurance running in combat boots or with a rucksack or with blouse pants. The blouse pants usually means that you're going to be cutting off some of your circulation in the lower leg. The rucksack, of course, adds extra weight, throwing off your posture. And the combat boots, again, also, if we can eliminate that, that can decrease injuries by about 30%. So really important. This slide talks about a running strategy program, and it's much like many of the well-known running room, for example, programs. Many of the governing bodies or companies that actually do this as a specialization, and you're going to see that ratio of 1-to-1 minute of walking to minute of running. The progression in 2 to 4 weeks would be, 1 minute walk to 2 minute run, and then certainly every 2 weeks until you get to a 1 minute walk for the 5 to 10 minutes of running. It gradually incorporates the overload to increase. And then you also want to take a look at incorporating some interval training rather than always just doing long runs. So then that makes running, within running itself, if running is your exercise of choice, you're actually able to cross-train, which will be really important, because if you're not just doing the long runs and now you're doing some interval running, you're doing some sprints, you're doing various different distances or speeds, that in itself is different than the exact same long run repetitively over time, which can cause that cumulative trauma. So some strategies for action. Really important to note that 80 to 95% of all injuries are preventable. And as that one slide mentioned, often they happen when they're supervised. And when they're supervised, they should be supervised by personnel that know how to suggest an injury-free workout. So making sure that you're adhering to the guidelines that you're being presented with, but also knowing the education and the literacy around injury potential. Another strategy for action is training. That'll be your consistency or variety. Variety is really important. For a long time, cross-training was an important concept that we just expected everybody to include into their workout regime. Well, not everybody does. And without that cross-training or that variety, there is the potential for the RSI. So that would be, as an example, you have a 5-workout week, let's say, you might run 2 out of the 5 days of the week. You might do a spin class, you might do a swim, and you might go for a hike as your 5th day of high exertion or mountain bike. That variety would be really important, because all of those activities, some of them are weight bearing, some of them aren't, some of them are the same muscle recruitment, some of them aren't. Some of them involve other parts of your body, so a bit of a diverse approach to your workouts. So recognizing that variety piece is huge. In fitness, we talk a lot about the principle of progression, so slowly adding in that overload over a period of time that does not set you up for an injury, but in fact prevents one. And then the moderation tool, so making sure you're doing things in moderation. So as much as we are worried about our Canadian population exercising enough, we also have a population that exercises too much. So making sure things are done in moderation and being very mindful of your exercise selection as it relates to injury potential. So for example, you want to train for an upcoming rigorous activity and you think you should be training in combat boots. That exercise selection puts you in the bracket of injury potential. So recognizing the selection of exercise will play a huge role. Make sure you're wearing the equipment. So you take a look at any racket sport like squash or badminton, proper eyewear. There would be the acute injuries that take place. Nutrition, you want to make sure that you maximize your performance and you enhance your recovery by fueling your body appropriately with that glycogen store issue, carbohydrates, hydration levels, etc. Making sure that nutrition is a consideration for the most ideal exercise regime. We also want you to remove painful exercises. If something hurts, that's your body telling you, your kinetic feedback, that you should minimize that and remove that exercise. You might have to adjust your daily habits. You might have to change something up. You're going to have to maintain some fundamental mobility, and the same for your stability. So implementing that into your workout regimes. Mobility and stability, really important. You should address the asymmetries. So in fact, if you are recognizing that your dominant side is much stronger, making sure that the parity of those muscles is considered so that you are addressing any asymmetries. Making sure you're wearing that protective equipment and making sure that you select those exercises appropriately. So if you know that you're not a strong cyclist, mountain biker perhaps, and you take to a very technical trail and you're not super strong in that particular exercise, the injury potential is higher because the technicality of the technical element of the particular course that you're riding. So the selection of the exercise, what you're going to do, how you're going to do it, where you're going to do it, really important when you're looking at minimizing the risk. So just a quick review. We want to modify fitness schedules. We want to have high and low impact days. We want to have alternate days to cross-train. We see that the scientific evidence has weighed in that it decreases our overuse injuries, it increases our bone strength, helps to maintain balance strength. We want to have carefully planned progressions, so decreasing training intensity for those who might be unaccustomed to training. We want to include variety in our activity, active recovery and rest. That's been shown to decrease the overuse injuries. Decrease injuries for running strategies, making sure you're implementing them for individuals and groups. Making sure you're doing those key fitness elements like warm-ups, cool-downs, exercise selection, nutrition, all of those fitness elements into your training program, and making sure you're using proper kit and safety equipment. So it'll be really important to, as mentioned, protective eyewear as an example. Those sorts of things can absolutely help with the injury potential. And then if you think of your sport, shin pads for soccer or equipment for hockey, perhaps a helmet for cycling. Those are just some of the considerations when you're talking kit and equipment. So just again, back to those first few questions and adding in a couple. Are you maintaining, increasing, decreasing your exercise? What's your favorite physical activity? And ask yourself, is there anything you can do or add or implement to your current regime that will assist you in this important concept of reducing our injury potential? Because we know that it can absolutely impact our professional life, but it can also impact our personal life, and it is, in most cases, preventable, these injuries. So thank you for joining today, and we'll see you next time on the Wellness Project series.